Welcome back to Central Valley Talk. I am your host, Mike Briggs, and we have a guest coming up in a minute who comes on from time to time to bring us up to date with some things that are going on in other parts of the state, particularly Southern California. Our guest is Karen Roseberry. Welcome, Karen.
Mike, thank you so much for having me on. It's great to be back with you.
It's my pleasure. Now, are you addressing a statewide issue? I guess it is, but also specifically something that's going on down there?
Yes. So today's kind of a county-wide issue, but it may be something that spreads county to county throughout the state if it's not nipped in the bud. So down in San Diego County, which is actually even a little south of me, I'm actually in Los Angeles County, but coming up on December the 5th will be the second time that the San Diego County Board of Supervisors will be addressing a proposed agenda item. And it was defeated in November on a 2-2 vote because the seat of the supervisor of Nathan Fletcher had been vacated based off of his resignation. That seat will now be filled. A special election has taken place. So they're back up to 5 supervisors for the December 5th meeting. But on the November 7th meeting, there was an agenda item proposed by Tara Lawson-Remer to explore the closure of all of the pregnancy centers in San Diego County. And this is just an egregious act by this individual who honestly is doing it as a publicity stunt. She has an election coming up where she's going to be running against Kevin Faulconer, the former mayor of San Diego, for her county supervisor seat. And so she was trying to basically get free press, that this was, some, earned media that she was trying to push with this item, and it's really just absurd. Most people don't even know what pregnancy centers do, because if you're not a pregnant woman, you probably haven't even had the occasion to need the services of a pregnancy center. But we provide free services to those who may think that they're pregnant. We'll offer them a pregnancy test. Most of us are. When I say us, I'm the executive director out at the Pregnancy Center at CareNet Women's Resource Center in Lancaster, California. A good number of us are medically licensed clinics by the California Department of Public Health. And yet there's been just a railing of misinformation about what we do. We provide women accurate information so that they can explore all of their options about their pregnancies. Most of us do not perform or refer for termination, but we will give accurate information so that a woman can make an informed decision.
And what do these pregnancy centers do? Absolutely.
So we provide free pregnancy tests. If the test comes back positive and it's a medical clinic, then we will offer a free ultrasound to the woman so that she can see exactly how far along she is in her pregnancy, which is crucial for whatever decision she wants to make. Right. In terms of the type of procedure that she may even explore, but hopefully she understands what's happening with fetal development and the gestational age of her child. We also want to make sure that pregnancies are in utero, meaning that is the pregnancy in the right place, or are we seeing it where it's supposed to be? Because if it's not, she needs to get treatment and care for that, and we refer immediately for ER visits or urgent care if we're seeing anything that is abnormal, and not where it should be in the pregnancy. We also look to detect cardiac viability, the fetal heartbeat, and making sure that the baby's actually alive, because she might be being torn up over a decision that has already been made, because there are pregnancies that do naturally end as well. And so we want a woman to have the best possible information before making a decision that has life-altering effects.
Now, don't they want all pregnant women to go through these tests and what do you call it, the prenatal stuff?
Exactly. So the Mayo Clinic supports first trimester ultrasound, which is typically what is performed. Most pregnancy centers can go through the second trimester, but our hope is to refer and get women in with their OB doctors just as soon as possible. And to help them with that process, they get a verification of pregnancy or a confirmation of pregnancy that then helps to expedite their intake process into their OB. Into their OB doctor's office. So we help to accelerate that, because in my area, my service provider area of Los Angeles County, and this is not uncommon throughout the state, but we are a little bit of an underserved community, which is oftentimes where pregnancy centers serve the community very well. our area has 1,500 women who have not received any prenatal services in the first trimester of pregnancy.
Right.
And we hope to meet a need that our communities desperately have for women especially. And so when we look at, and oftentimes the highest population of women that we see are, minority women, women of color that need services for their pregnancies and are having difficulty finding them.
The people who can't afford. And because they can't afford
Exactly.
it, they wouldn't even get the early care or things they need. Men don't know much about this stuff, but it's very important.
Definitely. Oh, absolutely. I mean, so many times they may be uninsured women. We don't even actually ask for their insurance status, so I can't always guarantee that. But in the course of our conversations with the women, they'll volunteer that information, and we just let them know, you don't need to provide any proof of insurance. You don't need to provide any proof of residency. You don't need to provide, walk through our door. If you have an ID, we do collect that so that we can start your medical records. If you don't have an ID, we can work with you and get the information, take a picture, and just move through that process so that they get the help that they need.
Right. It sounds like you're providing a tremendous service, and it's free?
It is.
Yeah.
It is. And yet we have politicians and elected officials that simply rail against us. They accuse us of just the most distorted things imaginable, that we're providing misinformation, that we are coercing women. Our doors are wide open. Women walk through the doors completely voluntarily. They're free to leave at any point in time. We are upfront and honest with every woman that comes through. If she's not sure about what she's deciding, we want to let her know what services we do provide, what services we don't provide. But we want to make sure that before she makes a decision that she can't take back, that she has the information that she needs to make that the most effectively as possible. Because there's no do-overs with what a woman is facing during this time.
Right. Now, to help me understand the issue, somebody in the county board of supervisors in San Diego County put a resolution to try to close down these places?
That's exactly correct. She put forth an agenda item that wants the county attorney to explore measures to essentially sue pregnancy centers, shut them down, go after them because of alleged misinformation. This is something almost out of 1984, where the government is trying to control what is, truth and what is information. We simply provide information and data to women. There are numerous studies about the mental health effects of ending a pregnancy, before the delivery takes place. There are, the physical effects that are there. And so many times women have just not been made aware of the risks that they could be putting themselves, and subjecting themselves to for a decision. And yet that is not even allowed to be discussed. It's like, nope, there's one outcome that is permissible for discussion. And if you do not provide, termination services, then you're providing misinformation. And that's just horrific. It has nothing to do with the truth or what the data actually suggests. And oftentimes, women that find themselves at risk during their pregnancies have faced a series of other emotional issues that puts them at a higher risk for things like anxiety, depression, substance abuse, things that are already correlative when decisions are made that they may later, 5-10 years down the line, end up regretting.
If, say, San Diego County was able to pass something and they shut down these care centers, how many people do you think would be left unserved if that happened?
Thousands.
Thousands.
Each pregnancy center sees hundreds of women each year. And so there's at least 16 pregnancy centers that have been referenced in the agenda item and the supplemental information that this supervisor put forward. There's actually, I believe, a 17th pregnancy center that's even there in the county. And I mean, goodness, even if they only saw 100 a year, and yet far more often, it's usually probably between about 200 and 500 women each year for each center that is seen. You're talking about, maybe even, my math could be a little off, but I mean, if it was 500 women over, 1,700, or I'm sorry, over 17, pregnancy centers, you could be looking at, 5,000 to 8,000 women or so that aren't receiving the care that they need during their pregnancy.
Now, is there some effort, I read through the notes you sent in advance, is there some statewide effort to do something like this?
So there have been legislative bills that have been put forth. There were at least 3 in the last legislative session. 2 of them did go down in defeat, mostly through appropriations. There is another that's a 2-year bill that's a carryover that we will see coming back again in 2024. That we'll be, working to hopefully, bring our partners and our community leaders together. I mean, this is a highly unpopular bill, policy, regardless of one's views on choice, on life. The simple fact of the matter is that pregnancy centers are actually well liked across the board by public opinion. 9 out of 10 people that, when they actually find out what a pregnancy center does, they are highly supportive of the work that we do. The women that come through our doors, they fill out surveys and off the charts. I mean, in terms of their satisfaction, they don't receive the level of care that they get here anywhere else. We have women that are, can we stay here for our, entire OB care? And, that's not a service that we provide. There's a small select number that actually go a little further with care. But we want to make sure that they're in, and we do stay with them and walk with them through their pregnancy. We provide baby showers for them in their 7th month and, material things and needs that they have, diapers, wipes, baby clothes. We have parenting classes, so practical skills that help them, with just life and parenting. So it's not just a one and done, okay, here's your pregnancy test, you're positive, have a nice life. We provide, holistic care to women so that they know that this is a place where they'll be listened to, they'll be heard, that they have a community that's around them that supports them, and that they're not alone in their pregnancy journey.
Right.
And so for Sacramento to want to shut that down, for other counties to be considering this type of action is just lunacy.
Yeah, I know we have one near our studios here, and they do a tremendous work, and I have them on the show, and every time I make them come and tell me every year or so, really, you do this, and it's all free, and any girl that's pregnant can go in there and get your services for free. It's just mind-blowing, and the prenatal care that's so important that young kids often don't have the insurance. They're not kids, 18, 20, how old they are, they don't have the insurance
Exactly.
to do that. So, and by the way, the parenting classes, I had 3 kids. I never had a parenting class, but man, I sure could have used one.
Think we all.
So it's good for you for doing that, Karen. Thanks for bringing this issue up. Get it on the radar screen of us here in Central California. Any last thoughts for our viewers?
Oh, if you are interested in this issue, I do hope that you might go over to the San Diego County Board of Supervisors website. December 5th will be the meeting. Anyone throughout the state can call in because this issue really will have a ripple effect throughout other counties. And I would just encourage everyone that might be hearing this, that cares about this issue, that wants to make sure that women have the needs that they need to have met, and that services are provided to them. Call into that meeting. Like I say, it might take a little time, but you can, put your phone on, mute and hold and just, let it, sit there. But speak your mind. Call in on December the 5th to that San Diego County Board of Supervisors meeting, and let people know that pregnancy centers are doing a good work. They should not be on the attack, radar of those for publicity stunts, and that this is not an issue that is going to advance their cause. It simply is going to alienate people from what it is that they think that they're trying to accomplish. Because people are going to hold the views that they do, but people need help as well, and that's what pregnancy centers provide. So letting them know that they do not want to see them shut down. This is not the avenue of attack for political agendas.
Great. Well said, Karen. Roseberry, all the way from where are you, Los Angeles?
Yep, Los Angeles County. Lancaster, California is where I'm at right now.
And thank you for bringing us up to date, and we want you back. Anytime you have an update, please come on Central Valley Talk. We'll be back with more.
Thank you, Mike. I appreciate it.
More Central Valley Talk right after this.